Good afternoon. Hello, North Dakota, and thanks for joining us for today's April 28th press briefing. Today, the Department of Health confirmed 49 additional cases of the novel coronavirus disease, or COVID-19, out of 1,289 tests. This brings today's rate of confirmed positives, the 49 divided by the 1,289, to 3.8%. And again, the 1,289 were the tests that were completed by all of the state lab and private sector labs that are doing tests during the 24-hour period that concluded this morning at midnight. So this would be Monday's test runs through the labs is the time frame that these came in. Likely these were collected on Saturday or Sunday around the state because in yesterday's numbers, all of the majority of all of the 1,100 tests from the Fargo Dome were in yesterday's numbers. But again, that 3.8 is today's positive rate. That's a good sign. That continues to go down. The cumulative rate for the entire duration since our very first case, 4.2%. That's how a lot of the analysis is done, comparing states to state. That is the fifth lowest rate. Low is good on this. It's like golf. You want to have a low, be low on this one. Fifth lowest rate in the country behind Hawaii, Alaska, West Virginia, and Montana. When we take a look at that testing number, again, we remain number 6th in the nation per capita testing. And again, we hope to continue to keep climbing in those ranks. It's important that we continue to keep our testing volumes up. It's the key to the execution of us to safely building our economy because that's how we both monitor through the testing and then contain through contact tracing and targeted quarantine. And again, as we execute on the North Dakota Smart Restart, confidence that customers, consumers, family members, that they can safely move in and about in public spaces is going to be key to helping our economy recover, and testing is one of the keys. So again, we continue to really focus on building that capability. When we flip to take a look at active cases, because again, this is something I would love to make sure that we're getting a focus on this as a state. This is certainly what we're looking at. Now, we're not spending a lot of time looking at total cumulative cases because the ones that we have to manage are the ones that are still active. And we have seen of the 991 cases we've had in North Dakota, 409 people have recovered. And fortunately, today we're reporting no additional deaths. We do have 25 people hospitalized, which is a new record high for us, but that is the still 1% approximately of all the beds available in the state. So one of our criteria was, do we have enough hospital capacity for COVID? And we certainly do. And again, credit and shout out to all of the health providers in North Dakota for the great work that they're doing. When we take a look at the case trends on the next slide, which we've been looking at throughout, the real headline from this should be active cases decline. We had more recoveries today, 59, than we had new cases. So we have minus 10 on that line on the top. And again, from a management standpoint, this headline, we've seen a lot of headlines that say, every day cases continue to decline. Well, they're referring to total cases that are cumulative. That's always going to be the case because cases that were positive once, we don't get to undo those, and so we will always have a climbing case number in an absolute sense, but again, really want the state and the citizens and policymakers and everybody to focus on active cases. And today, the right headline would be active cases decline. So again, congratulations to the 59 people who recovered. We are super excited for them. This 59 recovered is a new record that breaks our previous record of 40 recovered cases set on April 23rd. When we take a look at the positive rate of completed tests over a 14-day 14-day rolling average, which is one of the ways that the White House has asked people to take a look at these gating factors moving for the for what they call a phase 1 reopening, and that would be this is flat or declining. We are off slightly from the peak. We were at 6.4 down to 6.1, and again, some inquisitive minds have asked, how is the 6.1 different from the 4.2 you showed 2 slides ago? Well, the 4.2 is the percent of positives out of all the tests taken since our very first case back on March 11. This is just showing the rolling last 2 weeks. We take the most current last 14 days and calculate the number of positives in that time frame. That's at 6.3%, and again, very low compared to the rest of the nation. When we take a look at active cases by county, again, we're focusing on active here. We can see that there are the cases are spread across the state, and just like we say, there's different curves and different outbreaks, you know, across the nation, that no state is the same. It's the same here, that no counties are actually the same. When we started out earlier in this, we had a higher concentration on a per capita basis in the West than we did in the East. That's shifting now. 31 of our 53 counties currently don't have an active case. That's a really good thing. And 13 of those were counties that previously had positives, but now everyone who recorded those counties as their home address have now recovered. So again, we're have about 60% of the counties in the state right now currently don't have an active case. That doesn't mean that there isn't COVID there. It's just that it hasn't been identified and not shown here. On the next slide, on the active case rate on a per capita basis, again, this starts to show the concentration that we're having. A lot of states have had more issues with outbreaks in urban areas where you've got higher density, and that's starting to shape here. On average in North Dakota, 7.4 out of every 10,000 people. Again, a very small number of people, but 7.4 out of 10,000 have a current active case of COVID-19. Of the 22 counties in North Dakota that are listed here in various shades of green, 18 of those counties are below the average and only 4 above. And you might say, how is that possible if it's an average? How can you only have 4 above? Well, it's because of the weighting factor. We're Cass County at 15.4%, almost double the state rate, and Grand Forks more than triple in terms of active cases per capita or per 10,000. So again, that's where we're seeing those concentrations. People might say, well, gee, you know, what about Grand Forks and Cass? Don't they represent a big risk? Many of the cases in Grand Forks related to the commercial plant outbreak, those individuals are quarantined. A number of the cases in Fargo relate to long-term care. Those folks aren't going anywhere. And so again, we have to sort of drill down even further into these numbers to actually sort of say, of the active cases, how many people are out and about? We'd like to say very few, because if you've tested positive, you are either be in a care facility, a hospital, or under isolation at home. And if you've had close contact with a positive, again, either you are actively being asked to quarantine, or you are doing so mandatorily or out of your own individual responsibility. So again, we would like to think that where we know we have known cases, these people are not out in the not out and about. And so again, we feel comfortable continuing to move forward, but it is a reminder that if you do live in an area that's got higher population density, always good for sure to be practicing the North Dakota Smart Hygiene protocols that we've discussed. In terms of the criteria for the North Dakota Smart Restart, we went over those in depth yesterday. I just want to touch on those again briefly here today, that we had the 8 of those. The first 2, testing and contact tracing, we want to share some national news on each of those. And then the 7th one, new standard operating procedures for businesses. Michelle Comer is going to join us by phone and talk about our additional rollout of those today. But let me just say again, we think that we're in great shape on 6 of these 8. We're beginning on the 7th out of 8, the new standard operating procedures. We're going to get a partial check mark there today because we're starting to roll that out, and we're continuing to work to ensure that we've got protections in place for the most vulnerable, and more meetings this week, and we'll give you more updates later on this week as we continue to work on that. but let's go to some national news. The first one has to do with test capacity, and this came from the Opening Up America, or the White House sent out a packet of information as part of the call with the governors yesterday, and they were showing here states that had a high amount of testing capacity per 1,000 people. And of course, North Dakota has got in a good spot with our neighbors, Great Plains neighbors to the south, where we're in a part of the country where there's a lot of testing capacity per person. And the good news, even more so in North Dakota, because this is capacity. It's not whether the tests are actually being taken. But as we stated earlier, North Dakota's moved up to number 6 in the nation. We were at number 9 over the weekend, but we moved up to the number 6 spot in terms of actual testing per capita, not just test capacity. We are going to continue to expand our test capacity to make sure, because we know that's one of the core public health pieces of infrastructure we need for us to, again, get our economy reopening. The second one just came out this morning. This is a fun one. We've talked a lot about contact tracing, something that many folks probably had never heard of before the pandemic. And this is the practice of once we identify someone who has the highly contagious disease, they literally get contacted by someone by phone, and then there's a phone interview, and they say, who have you been in close contact with? Who might you have transferred this to, so we can again alert those people and try to slow or arrest the spread. And this was a fun one because there was when this one came out on the relative to the NPR story, it said North Dakota stands out dramatically from the pack, having almost more than double the number of contact tracers than what their threshold was here. Their threshold is 30 per 100,000 residents. We're tracking well above that, and we're going to continue to add capability. And then we're also going to add just not numbers of people, but productivity through the work we're doing with the Care19 app, which we'll talk about later, and also on the back end to make sure that we've got great productivity for those people doing the contact tracing. So those are two fun pieces of national reinforcement that we're definitely leading the way on both testing and contact tracing. In terms of a thing that we thought we should touch base on as we talk about the North Dakota Smart Restart is to give everybody just a quick reminder about how the virus actually spreads, because the whole point of the physical distancing and the work that we're doing in terms of practicing the North Dakota Smart hygiene requirements was to slow or stop the spread. And probably these are good things to do at any time, or during flu season, whatever. So maybe we'll all become a smarter, healthier state and a smarter, healthier nation. But I wanted to just touch on this again. The virus does spread both person to person, and it spreads by people, someone who's symptomatic putting the virus on a surface, and then someone else touches the surface. It's unknown exactly how long the virus can live on the surface. It depends on the surface. If it's a hard, like a hard metallic surface, like a doorknob or a door handle, it could live a very long time, hours and hours, and some studies have said even up to 18 hours. And so you have and of course, that is affected by temperature and humidity and other factors that go into that. We're learning a lot about this virus as we go on. But I think the key here is whether it's person-to-person contact or surfaces, one of the ways to avoid person-to-person is the 6 feet or length or distance. And again, if some people I know have a, challenge understanding distances, maybe if you're challenged on parallel parking or backing up, you might be challenged on distancing. But again, this is one simple way to know whether you're 6 feet apart is spread your arms out, and if there's got to be some space between you and the outstretched arms of the person next to you for you to be more than 6 feet away. And so 3 feet doesn't equal 6 feet. This is a guideline for a reason, so that's one. And of course, if someone coughs or sneezes, all the folks that we've talked to from the medical field can say that when this thing gets going and you're contagious, there's a enormous amount of viral load in the nose, and particularly even in the lower nose. That's why now they know that we can accurately do testing by just doing swabs in the lower nose. But when someone were to cough or to sneeze, put those respiratory droplets into the air, they can carry a long time. So this is why it's really important to cover your face when you're sneezing or coughing, or wear a mask to do all that. But that would be, or to prevent that, but that's important. And then it also is important to remember that part of what's tricky about coronavirus is it can be spread by people who are not showing symptoms. This is one of the areas that remains unknown. We'll know more about this when we get more widespread antibody tests in terms of who's had it and who is symptomatic and who not. But remember again that it's not just people that have symptoms, but people that don't also need to practice this, because you could be unwittingly be a spreader of this disease without you even knowing it. And lastly, again, we've talked about that it can live on surfaces and frequently touch surfaces, whether those are door handles into public spaces, or as we start re-entering, bars, restaurants, gym equipment, all those places that you might be touching. And so again, and we've putting a lot of responsibility on the business owners to make sure that they're taking care of those services, but also as you as a consumer, probably smart to travel with hand sanitizer. If you're going to the gym, you may want to wipe down the equipment yourself if someone else has used it. There's a lot of things that you can do to protect yourself and protect your family. If you know how it spreads, take action to make sure that you're stopping the spread, help you and help all those around you. All of these are incorporated into our North Dakota SMART guidelines, and which we've covered before, again, about washing your hands, do it frequently, do it for 20 seconds or more, and do it well. Make sure you clean under the fingernails. Staying at home, again, as we start to give the guidelines about some high contact businesses, as I'm calling them, to reopen. Again, if you're someone who is over 65, if you have an underlying health condition, we strongly recommend that you be very choosy about where you start engaging publicly again, and even to the point we think it'd be smart to spend at least the next couple of weeks as we start to reopen things up to make sure that you're staying a safe distance from places where lots of people that are outside your own pod or family group are congregating, to protect yourself. Because once we start to take the dial off the controls, we know there's a lag time. It takes 14 days for the full run of the course of this. And so whenever we've got data, it's always lagging. So as we start to have more transmissible contact moments through personal care businesses and bars and restaurants and gyms, if we have more contact, we won't know if we've opened the dial too much right away. We may not know for a week or two. So while we're learning about how much transmission may be occurring as we go back to having some more high contact businesses open, again, those that are most vulnerable would be advised to stay home. Another thing which we want to make sure that we understand about the North Dakota SMART restart element is that reopening is completely voluntary. Any business owner has got the right to choose when they're open or not, and if you're uncomfortable in whatever business you're in about reopening, about the safety of yourself, your team members, or others, you can choose to not reopen, or of course you can choose at any time to come up with a new business model that might allow you to keep your business going but have more distance involved, whether it's if your business allows a virtual aspect to it or not. The North Dakota SMART Restart Guidelines, which we're going to talk about next, is something that, again, we want to talk about for all industries. As we know that 93% of the jobs in North Dakota remained open. That was all of energy, all of agriculture, all of manufacturing, all of construction, all of healthcare, including elective surgery, all of education, all that was done through distance learning. All those were open. Many of those organizations that involved having contact with the public have done a great job through their own choice of protecting their own team members and their own team members and their consumers and their customers by matching up with great hygiene practices going forward. And as we move forward, the North Dakota Smart Restart is going to include standards for all industries, not those that were affected by the 2020-06 executive order that required those high contact businesses to close. And we got a list of things that will be included as a summary of that, but adhering to CDC guidelines for businesses and employers. North Dakota Department of Health recommended for public. There's a workforce assessment tool to help you make sure you've got everything lined up for your business. Many organizations have already done the following, which is limiting the number of people occupying the facility to ensure 6 feet apart, 6-foot increments, and wherever lines might form, signage at entrances, asking people if they are symptomatic to not come in, maintain distance, wash hands, limit unnecessary contact, encourage the use of cloth face coverings for employees and others, providing new, contactless payment systems, disaffecting all payment portals or pens, or having reusable pens, any place where you could have a transmissible moment, more hand sanitizer, soap and water, or effective disinfectant at entrances and other appropriate areas, regularly disinfecting high-touch services, and developing policies and procedures for prompt identification and isolation of staff or customers that may be showing signs, and encouraging customers to download the Care19 app. Our success was really built around a light touch and a few mandates from government and a high voluntary compliance, and we had that in North Dakota. We've seen that in the results, the numbers. So again, great job, North Dakota. Now we're counting even more as we move towards reopening high contact businesses, even more that the individual responsibility of business owners and customers and employees, that they protect themselves and those around them. The executive order, again, as a reminder, which touched 7% of the jobs in North Dakota, was restaurants, bars, breweries, and cafes. A number of them have been open for either drive-through or takeout, curbside pickup type businesses that they've kept going, recreation facilities, health clubs and athletic facilities, licensed cosmetologists, which includes, of course, esthetician, manicurist, barber and beauty salons, barbershops, personal care, tattoo, body art, tanning, massage therapists. So again, there's a combination of what we'll call high contact businesses, because these were closing the fewest number of businesses. Understand they also happen to be ones that North Dakotans care a lot about, their favorite restaurant, their favorite bar, their personal care folks that they may have been seeing regularly for things like haircuts. We know that people cared a lot. We targeted those because that was where we had contact of less than 6 feet for more than 10 minutes, almost as a necessity of doing those businesses. And so again, we're grateful for the sacrifice and the participation that those businesses have shown. And we also, again, want to continue to work with them through economic recovery, either directly in helping them with the many and large federal programs that are available to help those folks, whether it's payroll protection or the newly announced B&D programs. But again, we want to help all those businesses get back on their feet. We know a lot of them have also been able to apply for the new pandemic unemployment insurance programs, which allowed people to participate in getting unemployment insurance that even if they had never paid into the unemployment insurance pool. So some great, never before seen support for organizations like that. But again, know there's been a lot of disruption, and we thank you. Now we want to be standing by your side as we work towards getting reopened in a smart way. And I'm going to invite Commerce Commissioner Michelle Comer to talk about the North Dakota Smart Restart guidelines for the high contact businesses.
Thank you, Governor Burgum, and good afternoon, North Dakota. I want to say a quick hi to my mom and dad. Like many North Dakotans, my mom and dad tune into this press conference every day, and today is a little different because as we speak, my dad is waking up from a surgery that is a step in a journey to beat cancer. So go, Dad. We can't be with him because of safety precautions, so I want to thank those of you who rush into the fire every day, medical professionals, support staff, doing your job, and standing in for family that can't be there. So thank you to all North Dakotans who have showed up to serve our community during this time. You make a difference. As Governor Burgum said, we are fortunate that most businesses remained open, and now conditions are right to begin to reopen the businesses that were closed with strict safety precautions and a lot of responsibility for each of us at this phase. And it is a phase, phase 1, which suggests that there will be more. If we continue our good work, being responsible and conscientious and North Dakota smart, the next phase will be less restrictive, and that should be our goal. While my remarks today will focus on the subset of businesses that were closed by executive order, it's an important reminder that all businesses have been and will continue to be responsible to comply with guidance for all businesses for safe operation during these times. Also, as Governor Burgum mentioned, tribal nations, counties, cities, and subdivisions may place more stringent restrictions, and opening a business is voluntary. As I shared on April 21st, throughout last week, the Department of Commerce organized and coordinated 6 work groups representing businesses affected by Executive Order 2020-6. More than 60 people participating from 23 different communities across the state shared their time and talent in work groups representing the diversity found across their business types. These volunteers said yes when asked for help. Some even offered before we asked, and represented not just their own business, but their industry to ensure broad representation. The goal of these work groups was to ask the professionals closest to their work, their community, and their customer to arrive at North Dakota Smart Restart protocols that are practical, effective at controlling infection to keep employees and customers safe, and that inspire consumer confidence so that we may gradually achieve our new normal. And they accomplished this, proving that in North Dakota, with our hyper-connectedness and our willingness to support one another in a time of crisis, even if we are competitors by day, that we can succeed at reopening these businesses and doing it safely. The result of this effort is standard protocols for restaurants, bars, breweries, distilleries, and food trucks, hair salons, nail salons, barbershops, tanning salons, waxing studios, and other cosmetology-related businesses, medical spas, massage therapists, fitness centers, and finally, tattoo and body piercing businesses. The protocols recommended by the work groups made up of professionals representing these businesses were reviewed and approved by the North Dakota Department of Health. Examples of business-specific protocols include for restaurants operating at 50% capacity, for cosmetology-related businesses with reception areas, adjusting to ensure physical distancing requirements are met, such as asking customers to remain in their cars to come to their appointment once the prior client has left and cleaning has occurred. For tattoo studios, holding initial planning consultations by video conference if available. And for many of these businesses, screening employee and customer temperatures. We will provide guidance for movie theaters in the next couple of days. Larger venues, such as recreational and athletic facilities and music and entertainment venues, will also be addressed at a later time. And a reminder, it is only with these specific protections and all of us working together, business, employers, and citizens, that North Dakota will be successful in our smart restart. You can find this information at ndresponse.gov, where there is now a new landing page called ND Smart Restart. Today, this site contains guidelines for all employers, specific protocols for businesses affected by the executive order, FAQs, a toolkit, and links and resources for training and education. This site will continue to evolve in the coming days and weeks and should be your source of information for reference and answers pertaining to North Dakota Smart Restart. Next, businesses, please join us at this Thursday's special business briefing at 11 a.m. We will be discussing the Smart Restart guidelines in greater detail, as well as new financial resources made available by the Bank of North Dakota to support your business, updates on the refunded Paycheck Protection Program, and EIDL, as well as upturns and others. We have again partnered with the Greater North Dakota Chamber to deliver these business briefings. You can register at ndchamber.com, and you need not be a member of GNDC to attend. Let me close by expressing gratitude to those who participated in the business work groups, who volunteered their time and energy and passion to put North Dakota first. To the team at the Department of Commerce that reinvents itself daily, running on little sleep, but powered by an infinite passion for making a difference.
Thank you, Michelle. And I want to echo Michelle's gratitude towards all those frontline health workers, and certainly all of us here on Team ND want to give a shout out. We're all cheering for your dad and your whole family, and hope that you get great news coming out today. But thank you, Michelle, for dialing in. If going forward, one of the things that we know that there may be questions about this, I want to pull up a slide to make sure that we're directing people to the right locations. But if you've got concerns about workplace safety, then that would be OSHA. In terms of where you contact, we know that we've had referrals go there, and people feel like that they've been very responsive in following up, but that's Occupational Safety and Health Administration, federal organization that deals with that. If as we open up, you've got concerns about food and lodging or food and beverage concerns from a public health standpoint, then that would be calling your local public health organization. You can find them at northdakotahealth.gov/local health department, local HD, to help on that. If you have questions about all these business programs that we've talked about, you can contact the Commerce Department at commerce.nd.gov. If you have unemployment, that goes to Job Service, jobsnd.com. And of course, you can find all of these at ndresponse.gov as a landing page, which will take you to your area. And as Michelle just said, there is also a new subhead under northdakotaresponse.gov, which talks about the North Dakota Restart guidelines, which you've just seen, and those are already up on the website. One of the things that I know that moving forward, North Dakota has always had an ability to come through disasters and emergencies and come out even stronger than ever before. And we know that as we work together towards this North Dakota Smart Restart, we can work together to save lives and livelihoods. Our next section is good news, and we got a great presentation coming up today to share some good news about on the medical front about our fight against COVID-19. You've seen her present before from the press briefings early on. She's back again. She's our field medical officer with the health department, doing a great job. Dr. Joan Connell. Thank you, Dr. Connell, for being here.
Thank you, Governor Burgum. I'm so happy that Michelle Comer felt comfortable sharing a reason to celebrate her father's life with us today. April 28th is a day to celebrate life in my family, too, as it's my eldest beautiful daughter's, Lauren's birthday in about 12 minutes. So on this day, I am really pleased to discuss something that might help bring life to patients with COVID-19. As the weeks pass in this pandemic, new technologies and options are emerging in this fight against COVID-19, and we're leaving no stone unturned. As you know, there are currently no proven treatments for COVID-19 disease. One treatment that has increased likelihood for success is the transfusion of COVID-19 convalescent plasma. In fact, just yesterday, 2 individuals were discharged from a hospital in Bismarck after receiving convalescent plasma treatment and seeing immense benefit from this. With this treatment, severely affected patients who test positive for COVID-19 receive the convalescent plasma. Convalescent plasma is part of the contents of our blood, and it's able to be donated from individuals who previously tested positive for COVID-19 and have recovered. This plasma possibly has immune-boosting antibodies. The Food and Drug Administration is allowing for the transfusion of convalescent plasma as an investigational treatment. It's currently the only antibody treatment available for COVID-19 patients. The North Dakota Department of Health is working with Vitalant to offer this treatment option to more North Dakota patients currently battling COVID-19 disease. In order to do this, we need convalescent plasma donors and are asking individuals who previously tested positive for COVID-19, and you saw from Governor Burgum's address that that's a growing number, who meet these criteria to consider donating. Donors must have a prior diagnosis of COVID-19 documented by a lab test and have experienced complete resolution of symptoms for at least 14 days with a subsequently negative COVID-19 test, or have complete resolution of symptoms for at least 28 days. Donors must also meet all other donor eligibility requirements for an automated plasma donation, and this includes such things as being at least 16 years of age, weighing at least 110 pounds, and being in good general health. To become a donor, contact your doctors or visit vitalant.org/COVID-free to refer yourself directly for a convalescent plasma donation. This new treatment is still advancing in North Dakota. The more donors we have, the more people who can potentially be helped by this therapy. Now, if you are an individual or a family member who's interested in pursuing convalescent plasma for someone you love who has COVID-19, please contact your clinician to explore the potential for receiving this investigational treatment. For more information on convalescent plasma donation, visit vitalant.org/COVID-free. And for those of you who have previously tested positive for COVID-19, thank you so much in advance for considering convalescent plasma donation. I recognize this is a big ask as you're recovering from a pandemic illness, but I also know that you have a unique opportunity to maybe save someone's life. I'll be available for questions at the end of this. Thank you.
Thank you, Dr. Connell, and happy birthday to your daughter, and happy birthday to you, too, for that great day. And thanks for sticking around for questions. Next topic is unemployment. Monday's claims shot up again, 2337. Pandemic unemployment assistance claims, 251. Pandemic emergency unemployment compensation claims, 272, bringing our totals to 266 for total regular claims since March 16th and since April 4th, when the two other programs began, 9274 for the pandemic unemployment assistance and 10,010 for the PEUC. Other further updates on that, we've had questions on these before, but Job Service will be processing the pandemic unemployment assistance benefits this evening. They'll be loaded into a debit card, and that debit card will be mailed to individuals. If you're interested in receiving your PUA benefit via direct deposit versus by debit card, you can log into the Unemployment Insurance Internet Claims entry or the ICE portal at JobsND to make that choice. If you choose to do this, you will need to wait to receive your notice of determination of entitlement in the mail. This letter is your notice that your claim is currently being processed, and the system will accept your new ICE account. Trust fund update in terms of payments going out. Job Service processed and sent out to claimants last evening $12.9 million from the trust fund and $19.9 million from the federal programs. Trust fund, of course, is the portion that's the state portion. The current UI trust balance is at $130.8 million, so we are in better shape than most states. And as we said earlier, we did get clarity last Thursday from Secretary Treasurer, and again, thanks to our congressional delegation, including Senator Hoeven, who was here last Friday, for getting that clarity that if needed, one of the ways that we can replenish our trust fund balance unemployment is with the CARES Act dollars that the state of North Dakota received to be able to use to defer COVID-specific expenses. Cannot be used to replace a loss of revenue for any political subdivisions of the state. It's to be used for COVID-related, but unemployment insurance is one of those designated areas. On the behavioral health update, our next topic for the day, we know that when life is disrupted by natural disasters, it's shown that incidents of abuse can increase, and children in dangerous situations, perhaps previously, are put even in potentially more danger. COVID-19 global pandemic has certainly changed and interrupted the normal interactions between children and teachers, childcare providers, clinicians, and others that often might be the people who would be in a position to understand or be reporters of suspected child maltreatment. It's important to recognize the signs of child abuse or neglect, and these can be numerous. If you've got aggressive or repeated shouting, young children crying for long periods of time, significant changes in a child's behavior, such as being withdrawn, these are all signals to give us some alert. Very young children are particularly vulnerable, as they might be highly dependent on their caregiver and unable to share how they feel. Families experiencing new and unfamiliar stress, whether that's financial stress, changes of routine, new roles and responsibilities relative to employment, teaching, caregiving, these additional stressors, plus the social distancing recommendations, can lead to physical distance from those who can provide support or comfort, including grandparents or other family units that are isolated right now to protect vulnerable elders. It's okay to check in on children and families with questions. It's okay to be curious. Check in on parents and caregivers to see if they're receiving the support they need. Ask children about their experiences and listening to how they're developing to this situation, or how they're adapting, excuse me. We all have opportunities to reach out, support each other, and ensure that children and families have what they need, not only to be safe, but to thrive. And by supporting each other, we can reduce stress and isolation, which could lead to child maltreatment. Together, we share the responsibility of supporting families and ensuring children are safe. If you need more resources, visit behavioralhealth.nd.gov for information on how to connect and support families from a distance. And of course, there are hotlines to call if you have concerns about any particular individual. Care 19 update for today. Good news. Now it's available, searchable on the Google Play Store. For all Android users, it was available before. It took a little harder to find it, but now very easy to find. The Google Play Store would be similar to the Apple Store. So you can go on to the Google Play Store, search for Care 19, download it. It's free. Thank you to the many North Dakotans who have already downloaded it. Over 26,000 total users are helping to make contact tracing more effective and more efficient in North Dakota. And again, reminder, it's completely anonymous. You don't have to enter an email, you don't have to enter an address, you don't have to enter your phone number. It assigns you a random 36-digit number that can be used to try to help identify if you have ever been in contact with a location or other place where there may have been a positive case. So again, thank you for using this tool. It's going to help us get our economy going and growing. From the gratitude section for today, would want to give just an obvious one. We've mentioned them a number of times. Their leader has been at this podium, but I want to say thank you to all the men and women of the North Dakota National Guard. They're on the front lines of this fight against COVID-19. We have 148 National Guard members that have been called up in direct support of COVID-19. Another additional 19 are supporting the mission as a result of their federal duties. 30 more are already on alert to be ready to deploy in 24 hours if they need to be called up for what we call the deep clean mission, which we would bring in Guard members to help clean a facility such as a long-term care facility if we have a dangerous outbreak. And from administrating tests to helping plan and implement our statewide surge plan to making sure that all of our congregate living settings are clean and safe, we're in such a great position in part because we're due to their support and their leadership and the long hours they've put in. General Jimmy Doolittle once said, "There's nothing stronger than the heart of a volunteer," and it's important to remember that all the men and women in North Dakota National Guard are volunteers. They're also parents. They also often have a regular full-time job in the private sector, but it's their strong hearts, their volunteerism, and their courage that keep us safe from so many threats. We know that North Dakota National Guard is among the finest in the nation, and their motto is always ready, always there. They've proven once again that they are with the response that they've given as we've worked through this pandemic. So again, thank you to all of you in the National Guard in North Dakota who are serving our state and our country, and also a thank you to their families, because one individual serves, so does the whole family, so thank you. May coming up on Friday is also Military Appreciation Month, so take a moment to thank a Guardsman if you see him, and thank anyone around you who may be also serving currently in the active military. Thank you for joining us today. We are going to stand now for questions. I'm going to go Jacob, and then we're going to go online, and we're going to go to Lane.
Governor, yesterday you said that a lot of these protocols and whatnot, some of them would be rules, some of them would be guidelines. Just asking, what does enforcement of these policies look like?
It's going to vary. Some of those are going to be enforced through local health departments as a way to think about it, like you would with food and safety guidelines. And we'll make sure that we've got real clarity out there on the website in terms of what are guidelines, the guidelines that we're issuing and how we're going to do those enforcement. We'll make sure that that's very clear. But again, it'd be, if there is an enforcement component, that'll be done locally. We also think, again, because we're trying to have, be smart and light touch, hundreds of thousands of businesses in North Dakota, there's no way we don't have an enforcement group, law enforcement, to go monitor all this. So I think the real part of the monitoring is going to be smart employers that want to see their businesses thrive, smart customers that choose to go places where they know that they feel safe and comfortable, and smart employees that are doing their part to make sure that those businesses grow and thrive. And if employees have got concerns that they think their employer's not doing enough, first place to go is back to the employer and say, hey, I think we can do more. And second place, we put up a list of places that they could go with if they've got concerns for themselves. But again, I think this is going to be, market forces will help enforce this, because I think people will end up going to places where they feel safe and comfortable. We're going online, then Lane, and then we change the order up. Jeremy's way over here today. That's very confusing, but I will be. Okay, that's all right. It's good. Change is good. We all have to learn to adapt.
To that question, Matt Henson, WDAY, what are the repercussions for businesses who may violate those guidelines?
This will be all incorporated into a executive order, which is not completely finalized. We're giving the guidelines now to give people a time, if they choose, again, voluntarily, to start reopening on Friday, if we're able to keep on the good path that we had, again, with today's numbers and the low % positives. So we're getting those out. The actual executive order will come tomorrow, so there'll be more details tomorrow in terms of enforcement. But I think what we've seen same answer that we gave earlier throughout this thing, if we have executive orders and then they're supported by health department orders, then this would be a misdemeanor, which is managed locally. But we'll have more on that tomorrow. Was there another follow-up to Matt, or nope? Okay, all right. Lane, and then Jeremy, and then Tom.
Governor, if we are allowed to reopen this weekend, will businesses still be able to receive those unemployment program benefits, or does it depend on if they choose to open or not?
Really good question coming in. I don't know the answer to that. Maybe I can get one here by the end of the program. I think the key was not. I do know answer one. The one that was most widely used and was most sought after was the PPP, the Payroll Protection Plan. That had to do with keeping people on the payroll and paying, and you had to pay up to 75% of your payroll, and that didn't matter whether you were open or not. And so as long as you're paying your team members, I don't think you lose your eligibility for that. The key was that you kept them on your payroll as opposed to moving them over to unemployment insurance. So I believe that that's a grant. Mike, do you want to clarify? Well, Michelle is back on the phone. Okay, good news. Michelle, did you hear that question, and do you have an answer to that one?
Yes, Governor, you did a really wonderful job. If the employer has access to Paycheck Protection Program loan, then as you pointed out, the whole point of that was to keep people on the payroll. But when an employee applies for unemployment because they've been laid off or furloughed and they remain job attached, which means they intend to go back to the employer, they know they have a job there, when the work is there, it's at that point that they become ineligible for unemployment. So once they get notice that they're being called back, that is when their unemployment ends. And as we've discussed previously, and again, my colleague Brian Klippel is the true expert, but I can stand in his stead, that a person cannot choose to remain on unemployment if they have a job opportunity that has been provided to them. And so, as Brian would say, it's that simple.
And we do know, thank you, Michelle, for that fill-in. We do also know that some of those folks who, quote, were furloughed did maintain an attachment because their employers kept paying, for example, their health insurance, but they weren't paying their payroll. So they were getting health insurance from their employer. They were getting unemployment insurance if they get called back on the job. You can't be working and have a job and get unemployment insurance. Okay, Jeremy, and then Tom, and then Dave.
I think Dave sort of touched on this yesterday, actually. I'm just looking for clarification, I guess, between guideline and actual enforceable rule. Are these standards for restaurants, bars, fitness clubs, personal care businesses, are those rules that they would have to follow?
Well, we've listed them today as guidelines, and we'll provide clarity tomorrow as part of the executive order, because we may parse some of these into which are which. So we'll get you that clarity tomorrow when we come out with the exact executive order. But again, I think the real reality across thousands of businesses is that people are going to want to follow these. We're going to publicize them. We're going to put them out there, make people aware of them. And I think that you're going to see that market forces will drive people towards making smart decisions to protect their team members and their customers. Again, I mean, the rare case where there's going to have to be enforcement action, I don't know if that's going to be 1 in 1,000. I mean, we talked a lot about enforcement stuff here, and we've just gone through 5 weeks or more of 7 weeks of pandemic, and what we had in North Dakota was like 98.8% people complying and very few not. So I know that we want to get the precise answers to the questions that you're all asking here today. We want to be supportive of that, but I know we can count on North Dakotans to keep doing the right things as we begin to reopen the businesses that had close contact. Again, these are the places where there's a high potential chance for transmission. So we've got to be very disciplined in making sure that it's not happening. And of course, we do have, I've said before, and I'll say it again, which is, again, we hope to not go back to any statewide orders, but if we do have outbreaks that occur, whether it's a church, whether it's in a restaurant, whether it is a manufacturing facility, as you've seen us do, we will work with employers to, shut down, disinfect, close for 2 weeks, quarantine employees. All those things could happen. It doesn't mean to be punitive. It's the way that, again, that we can help protect the whole state, is to make sure that if we have an outbreak, if you don't want to have your business closed down because of an outbreak, then you're going to want to, which I don't think anybody would, you're going to want to work very hard to make sure that you're doing all the disinfecting and all the social distancing and all the stuff, because that's the way you can keep your doors open. So there will be market forces that will cause smart businesses to make sure that they're not only earning customer confidence, but they're making sure that they're keeping COVID out of their business places. Okay, I think it's Tom and then Dave.
Medical question for the doctor.
Fantastic. Dr. Connell, welcome back up.
Try and drill down a little bit on the composition of the product here for this therapy. There are many patients in North Dakota who are no blood patients that don't want blood. Would this, for example, with a Jehovah's Witness who is a no blood patient, would this violate that tenet for them?
That's an interesting question, and in my professional experience, that comes down to your personal understanding of that tenet of being a Jehovah's Witness. Plasma does not have blood cells in it per se, and so for many Jehovah's Witnesses, plasma is an acceptable thing that can be transfused. For some people who are absolute about it, then it would not be acceptable. Does that answer your question? Okay.
That's what I wanted to know.
Okay.
I don't usually get questions, but I have one for Joan, if you want to come back up. We were putting a call out today for people to donate. When they donate, is this like we think of all the times that people may have given blood? Is it just like that, or is it different? But come on up.
Yes, it's similar. You'll be asked to fill out a pre-screening form, and all of those same requirements apply. Again, if you are wanting to donate blood in 14 to 27 days after your recovery, they're going to be asking for a negative test to go along with your application. And then the process of sitting down, making sure you drink before you drink water before you go, that you've eaten something before you go for your donation. All those things are pretty standard. The process might take a little bit longer, and the other neat thing about a plasma donation is you can do it more than once. So every center is different. Last time I spoke with Dr. Greasons, who's one of the senior chief people at Vitalant. He was hoping maybe 4 to 5 donations would be possible from a recovered patient.
So give the gift of life. Again, thank you, Doctor. I think Dave was up next.
Governor, we just started talking about religion. You mentioned churches. Is there any special particular guidelines that are going to be issued to churches?
We will have, we'll later on the week, we'll talk about this again. Of course, churches were never closed under any executive orders. We had great collaboration, particularly during, very tough, during Holy Week. This is a time when you've got the highest church attendance often during the year, even more sometimes than Christmas. And great voluntary participation and great innovation in terms of where our faith leaders took their message and their care of their congregations online. We think as we open back up, there's a lot of things that churches can do that are pretty simple and low cost to be able to manage coming back together. Simple as blocking off every other pew. Family groups sit together, non-family groups don't. So you're more than 6 feet apart, offering more services or at staggered times, eliminating, the passing of the peace or the passing of, the traditional handshaking and greeting, but also literally not be passing the offering plate around where you might have people touching a common surface. So you're having to rethink all that. So there's some, basic new operating procedures that could put in place, and I think that it could be a great comfort for a lot of people. But there's an opportunity, particularly in the larger buildings, to really have a lot of space. But even having said that, again, we would encourage our faith leaders to encourage those in their congregations who are over 65 and have got underlying health conditions who might be really vulnerable to continue to try to serve them virtually for a while until we sort of see where this thing goes on this uncharted journey we're on, see how it goes as we start to dial a little more transmissible activity back into our economy to balance our effort to save livelihoods. To do that, I would think I would sort of exercise caution as opposed to under no situation would we be suggesting that people try to, pack it to the rafters right now. We would want to make sure that we're being very, very cautious about that. But I think a lot of faith organizations have done a fantastic job of moving to online, moving to virtual, and I'm sure some of them maybe have even increased their reach, during this time period, as other businesses have. But we can offer some more specific guidelines. But again, they were never closed. They can be open right now, but we would again encourage them to do that in a North Dakota smart way. I'm going online, then Lane, and then Jacob.
Austin Erickson, KVRR. A majority of coronavirus cases in North Dakota are in Cass and Grand Forks counties, with Fargo and Grand Forks having much larger populations and number of bars and restaurants. Do you feel a one-size-fits-all reopening policy is the best way to allow businesses to open their doors? And should there be different policies for larger cities or areas with more cases?
Well, if we thought that there was going to be a really dramatic difference, or if we thought that there was sort of some kind of wild, uncontrolled community spread happening in those communities, the answer to that question would be yes. But in taking a look at the numbers and knowing where the active cases actually are, if the active cases are they're active but they're already identified and quarantined or isolated, or if their active cases are people that were either healthcare providers that worked in nursing facilities or the residents in nursing facilities, we don't believe that there's a dramatic difference, per capita between those two counties and any other place in the state. So we're comfortable. We've worked closely with Cass County, Chad Peterson, who's the chair there, Mayor Bernie Darnish from West Fargo, Mayor Tim Mahoney from Fargo, Mayor Brown from Grand Forks. We've all been in close contact, and they were all, they all had the option, the ability to stay closed longer if they wanted to, and they've all decided to move in step with the state of North Dakota. As we've talked about, again, when you try to lock down one county, then you can end up with a lot of movement of people to the very next county, and that creates another set of unintended consequences. So I think trying to do a unified statewide North Dakota Smart Restart is what we've decided. And again, it's all voluntary. If there are businesses in Fargo, Moorhead, Moorhead, they're up to themselves, but Fargo, West Fargo, and Grand Forks in those areas that do not want to open this weekend, it's all voluntary. They can stay closed. Business owners can decide their own level of risk that they want to bear as they reopen for themselves, their team members, and their customers. And some may choose to not reopen, some may choose to open, but that's up to the business owners. And we'll keep working with local health officials and local community leaders to make smart choices. And as we've said, if we do think that we get to the point where we've got some kind of growth in breakout positive case numbers that are not being controlled under the current, we can always dial things back down again tighter, or we can do it in a targeted fashion. Okay, I think it was Lane and then Jacob, and then back to Tom.
To kind of go off of what Dave asked, do airports also fall under that same kind of category that churches do, since they were never ordered to shut down?
Yeah, airports were never ordered to shut down. Airlines were never ordered to shut down. So they'll, I know that the airlines are doing a lot to try to restore confidence in people that you can travel and fly safely. I think this has been there's a record amount of demand destruction for flights. There are more grounded aircraft right now than really almost, I suppose any time other than the 3 days after 9/11. And so that is the distancing took care of itself there because there was just so much lack of demand. But as they come back on and demand comes back again, as travel becomes more normalized, I think you'll see the airlines in the airports taking a lot of precautions, particularly as you might think about line distances going through TSA and how people are touching services. I think just like 9/11, travel became different. I think after the pandemic, travel will take on a little different flavor for itself. We might see more people driving this year. That's the other thing. I think for North Dakota, we may have to get ready that there could be a lot of people that decide they want to road trip this year versus get on a plane, and they may decide let's go to the places in the nation that have had the lowest positive rates. And you look at a map and you'd pick North Dakota, South Dakota, Montana, and Wyoming and say let's go there. So we could end up having a record number of visitors, and we'll just have to figure out how we manage that this summer, but particularly for those people that are in the tourism business, the hotel business, the restaurant business, all the more reason that we really get smart about the North Dakota restart, because we could be having a lot of outstate visitors potentially this summer, which if we can handle it, that's a good thing to get our economy going again, if we can handle it in a smart, safe, healthy way. Jacob?
Governor, referencing those debit cards that you mentioned earlier, some of the federal dollars that are supposed to come out with that, some of those federal dollars are a little bit slow to get rolled out. Wondering if back pay is going to be included in those debit cards.
Well, I would have to get the specifics, but I know that we're working very hard to make sure that everybody's getting paid the exact amount going back to the date that they filed. And so I believe that all those calculations, that's where we're doing all that extra work in terms of reprogramming the mainframe, was to make sure we took care of all of the payments to make sure that everybody gets what they're owed. With Tom, and then online. And then we'll take 2 online, because there's actually a big line of people online out there. I know there is. Okay.
Governor, I'm trying to figure out.
Another question for Dr. Connell, please.
I don't have one.
Okay. No, I was kidding. I was hoping. I was just hoping. It wasn't for you, actually. Okay, so I was
hoping that my people were 6 feet away from each other.
Okay. Yeah, they are. Okay. Tom, fire away.
Try to get a glimpse into how you are thinking about these things. We know now that masks help prevent the spread, but you've resisted ordering North Dakotans to wear masks. Is it a constitutional thing with you, or do you think it's just too intrusive for the government to be ordering something like that? What is your thinking about masks and ordering or not ordering?
Well, I think from a statewide perspective, you know, we're trying to take the least restrictive approach we could. And the initial thing you'll remember from the very first of these was our goal was the way you saved lives at the beginning. Before we had, you know, the therapeutic plasma transmission as a possibility, before we had anything else, the way you saved lives was you preserved capability at the hospital at the highest level of care, which you preserved your ICU beds, you preserved ventilators, you preserved the skilled individuals that could deliver that care. We I'm gonna say we crushed that. I mean, we crushed that like nobody else, because we never used more than 1% of that capacity for COVID. So then if you said, hey, do we need to put on more intrusive things to slow the spread even more, even if you said, hey, masks might be really effective to do that, you know, requiring everybody in the state to wear a mask, you know, didn't make a lot of sense. I mean, if some guy's, you know, working by himself, you know, during calving, and he's only seen his family, I mean, it wouldn't have made any sense. Part of it's in North Dakota is just being practical about some people who can spend, you know, days and days, or their, you know, weeks at a time without being within 6 feet of other people and still doing their jobs. In other cases, you know, if I'm an employer and I've got people working closely together and I want to keep my plant open, I might have just said, hey, we're all going with masks. Well, then that's not a local decision. It's an employer decision that's trying to protect their own workforce. So we felt that was a decision that could be used best locally. We will see that there's going to be probably more use of PPE going forward. I mean, I think, you know, when I was a kid, a dentist, you know, they probably weren't even wearing gloves when I was a kid. I mean, but, you know, I mean, then now they've got, you know, gloves, masks, face shields, I mean, all that stuff. I think we're going to see more and more PPE that are used where people have to be in close contact. The guidelines you saw that we offered today for those personal care businesses, we are recommending, you know, if you're getting a haircut, that certainly both the customer and the you know, and the provider are using masks. If you're going to have, you know, providers that are seeing dozens of customers a day, it just makes a bunch of sense to do that. So there are places where you use it, and I think I've said here before exactly. I mean, when we were kids, we didn't wear helmets when we rode bikes, and we didn't wear them when we were skiing, and nobody wore them when they were hockey, and you never saw a bull rider. We were wearing cowboy hats; they weren't wearing helmets, and now people do. But if you're in those situations, whether it's skiing, biking, bull riding, or hockey, you know, you have a helmet as part of your profession, but you don't wear it to bed at night. I mean, so it's like you've got to figure out when's the right time to use the protection and when it makes sense or when it doesn't. And so again, that's just back to common sense. So I think again, we were always thinking about people's individual rights. We were always trying to balance that idea of freedom and liberty and what individual responsibility could maintain. And I think again, we struck we came down hard on the side of individual responsibility in our state, and it's worked well. Okay, was it Dave next? No, we're going 2 online is what we're doing, right?
Yep. For Michelle, still on?
Great. Michelle, you still here?
Yes, I am.
Super. You got an online question coming at you.
Convenience stores continue to use soda fountain machines with self-serve cups, lids, and straws. However, franchise and other restaurants are excluded from using them. Can you explain why?
Well, I appreciate the question, and I think actually that's a question that's probably better suited for my colleague, Mylene Tufte. Is Mylene there?
Mylene is not here today.
Okay, we can follow up on that, certainly. Thank you.
GEM Hometown Radio Group, we've received questions specific to the use of restrooms in public places. Has the state developed guidelines surrounding public restrooms?
I know that we put in practices, which we talked about here a month ago, and when we reopened our rest stops, on the DOT, which again are probably the most used state public restrooms that come to mind. But I think this is a good question coming from Jean, and I'll make sure that we follow up, because this would be a good one for us to talk about with all cities and all local subdivisions that might have public restrooms. Probably be a good topic for us to talk about with the. So this will be an action item for our team with the North Dakota gas retailers. I mean, all the people that run gas stations and service centers. That'd be another one, a good topic for us to discuss with them about those public restrooms, because I know that that's a concern, particularly along the interstate with out-of-state travelers. And in some cases, we know some communities ended up doing the same thing that the Department of Transportation did for a while, which was close those restrooms because they were concerned about health issues or stolen toilet paper, and then that just leads to more problems when we don't have facilities for people to use. That creates secondary issues. So we'll take that one on as a good suggestion. Thank you, Jean. Lane and then Dave, and then Tom.
Governor, is there any concern?
And then Jeremy, sorry, I missed your weight on my range of view over there. Is there
any concern of false positives or false negatives impacting the numbers going into reopening?
I have very few concerns about false positives or false negatives, given now that we've done, 23,000 or whatever the number we reported today in terms of number of tests. I mean, we're getting at a scale of testing, 23,723. We're at a scale now where even if you had a small statistical sample, those that were wrong one way or the other, we're still in the directionally correct path that we're going down. I think that we also know that the PCR tests that are being done today have a high degree of accuracy. The machines that are being used have a high degree. When we get into the antibody tests, I think then we're, as we discussed, I think it was yesterday, then you might be dropping to a test that might, as Dr. Brooks suggested, that you should take 2 to reduce the possibilities of wrong outcome, because they may have like a 95% accuracy, but the PCR tests are very, very accurate. I mean, you're talking about teeny parts per million that are detectable in terms of detecting the virus, and the people that develop the tests have got they're looking for a very specific sequence that, in the protein sequences that they're looking for, so they can be very precise about how they do that. I think it was Dave. Was it Dave? Yep, Dave.
That you wanted to go to 4,000 tests, I think in May, 4,000 a day, 6,000 in June. How do you accomplish that?
The way we accomplish ramping that up is it's pretty simple math, which is we need more machines and we need more people to run them more hours of the day. So it's machines times staffing times hours, and the plan that we have in place would allow us to achieve those levels. There's some assumptions behind that. That includes that the new Abbott M2000 machines that are on order arrive. It assumes that we've got enough swabs and test kits. It assumes that we can get people hired and trained and get enough space. But the way that team is executing right now, and with General Schulte, taking the lead on that, I'm confident that we're going to be able to hit that capability. The one thing I would encourage, though, because you saw that we were 19,000 on testing on Sunday, Monday. Today we're down at 1,300. We we're doing less of the large-scale outbound. We need to make sure, again, I'm still seeing an occasional thing on social media, not me personally, but because I don't spend any time there, but it shared with me by our team, is that there are still people that are saying, hey, I tried to get a test and I couldn't. And I've said before, we want that to go away. I mean, if you've got the energy to post on social media that you were turned away or couldn't get a test, or you know somebody who knew somebody who couldn't get a test, call your provider, get tested. If you call your provider, you get turned away, then call the health department hotline. We're in a position now with enough tests, enough testing kits, enough capability. We've got this. We don't want to have, Dave, we don't want to have 4,000 tests available per day to run, and then people aren't coming and getting tested, or they're trying to get tested and getting turned away. We want people to get tested. The way that we control this is getting more testing done, and we've got the capability to do it. The federal government is supporting it with, financially. They've got a separate $25 billion was in the last CARE Act for testing. Some of that's going to come to states. Some of that's going to come, and that's on top of the $175 billion, $175 billion, $100 billion in the first tranche, $75 billion in the second tranche that are being delivered directly to health providers. So there's never been, I mean, the airline industry got $25 billion. Healthcare is getting $175 billion, and then another $25 billion for testing. I mean, the answer, it's a pretty clear signal, which is if you're in this country and you want to get a test, there's going to be capacity for you to get it. And this is before we even get into the antibody testing, which will be at a much even larger scale. So we want to encourage people so we can keep that inbound testing going up while we continue to execute on better and better outbound. Okay, online. I'm sorry, Tom, we're going to online. And then Mike, did you have a question, or are you telling me? Okay, well, I'm going to go online, and then Jeremy. I only went to you a couple times. I've only gone to Jeremy once, so I'm going Jeremy and online.
April Baumgarten, the former Fargo-Moorhead, President Trump has asked states to seriously consider reopening schools by the end of the academic year. Is that something you're considering, and what is your response to his comments?
We are seriously considering all options, and schools is one of them. But as I said yesterday, I think I've got a meeting tonight at 6:30 on K-12. We're soliciting ideas and options across a whole range, everything from not opening to opening on a limited basis. Do you open for special ed? Do you open for shops? Do you open in small groups? Do you not open? And talking to other governors on a call last night from around the country and serving, there was no other governors on that call that were planning on reopening schools because they're concerned about the cost associated with having to disinfect the schools every night. They're concerned about the sort of the risk benefit of injecting hundreds of thousands of kids. In North Dakota, it's 110,000, or other states, it's one of the highest congregate ways. You can't, a bar or restaurant can reopen at half their capacity. We can't say to the kids, oh, only half of you get to come back. So again, there some of the spacing and distancing challenges that we're trying to execute in the private sector could be difficult in education. But having said that, we're going to look at all kinds of options. The one real concern we have is that there are some kids that may be falling through the crack, as well as distance learning works for the majority. If you're some student who's vulnerable, we're trying to get an actual accurate number by school district of kids that may not have actually even been in touch with their teacher or the school district. Really, they've kind of fallen off the map. That's the situation that we've got to really be concerned about and really dig in and track on that. And then we also talked about that there is dollars in the CARES Act that can be applied towards schools, and whether it's trying to have a transition in the latter part of May into setting up summer school. Summer school may take on has been a pretty light activity in many school districts, or non-existent. Summer school could become a bigger activity in school districts this summer, and particularly as it relates to those that may have either fallen behind or those students who want to make sure academically ready to move to the next grade next fall. And we've even kicked around the idea of a brand new concept called an acceleration academy, and maybe that's something, if the virus is too strong to do it in May, then maybe the acceleration academies kick in 2 weeks prior to school in August, where we try to bring back in kids by invitation that could use a ramp up to get ready for school. So we've got dozens and dozens of ideas, all of which are going to be reviewed, none of which have been decided on. And of course, the safest course for virus spread would be to not have large congregate settings of kids. And you say, well, kids, kids can't generally don't die from this thing, but kids all have grandparents, and kids have parents that work in long-term care centers, and we have teachers that have got vulnerable, that have, that are vulnerable either by age or underlying health, and we've also got kids that have got underlying health conditions. So it's a really complicated thing, and I think that some people are just waiting for the day that we're going to say schools are going to reopen next Monday, and I feel again like that's not like turning the dimmer switch. That's like turning on the stadium lights at midnight when you say reopen schools, because all of a sudden, bang, 110,000 plus another couple 10,000 teachers and superintendents all getting back together. That'd be a big turn of the dial to do that. So we want to be thoughtful and smart about how we do that. But we're doing more research and more to come. But thanks for the question, Jeremy.
Hopefully. I'm just a little confused on whether movie theaters, music venues, and larger recreation areas are going to be allowed to reopen on Friday. You said the guidelines for them are forthcoming, but will they be allowed to reopen?
Well, we want to signal clearly, and we don't want you to be confused. That'd be a bad thing, so we don't want that. I'll signal even more clear. What the team is working on is we're working on a plan where we could possibly even by tomorrow give the guidelines under which movie theaters could reopen, because movie theaters to me are a little bit like churches. You got large spaces. I don't think people are going to be flocking back. It's possible if we said, hey, you could reopen a movie theater, they may not even have product purchased. I mean, in terms of film reserved. This is one business which is, something that a lot of, been a big part of some people's life. I know the First Lady and I have always loved movies as a great, getaway. So I'm definitely a fan of the movie theater business, but we do know that, Netflix added 16 million subscriptions in March. I haven't seen the numbers aren't complete for April, but there's been a sea change in terms of how people consume. People are consuming more movies than ever, but they're doing it from home. But I would say if you did open up a movie theater, if any of you've ever gone to a movie when there aren't a lot of people there, I've never seen strangers come and sit right next to the person that they don't know in the middle of the theater. You pick the spot that is, comfortably far enough away, but where you can still view. So again, I think that human behavior, but if movie theaters did what churches, blocking every other row, advising people to sit further apart, figuring out a way to disinfect between shows, maybe to change times, there's ways that they could do that. We want to work with the theater folks to do that. The other part that you asked about, Jeremy, which is large concert venues and all the things we haven't talked about that were never closed, but when you take a look towards the summer and we start looking at rodeos, county fairs, concerts, that's a whole nother set of things that we're not talking about reopening right now, because that's where you get a bunch of strangers together in close contact with each other, and we're going to have to put some thought into that. Would I love to see rodeo season this summer? Yeah, I'd love to see it. Can we figure out a way to do it safely? We're going to have to do some work on that one. But movie theaters, we're hoping to have guidance tomorrow for them to potentially reopen on Friday voluntarily if they want to. They may decide, I don't want to reopen because I can't make money, running films for, half empty or quarter empty theaters. So again, there'll be choices on how people do that. But on the other venues, the executive order will certainly state that those are still not open. I mean, the large concert venues. Okay, Mike's giving me the signal. Sorry for Tom and online and all the others. Thank you for being here again today. We'll see you tomorrow at 3:30. Appreciate all the inquisitiveness and all the good suggestions. Have a good evening. Thank you.